In this video, we are going to talk about the hypertension. To understand hypertension, we need to start from the concept of blood pressure. With each heartbeat, the left ventricle pumps the blood into the aorta and subsequently through all the arteries of the body, thus putting pressure against the artery walls. Thus, the pressure exerted by the blood against the artery walls is called the blood pressure. A blood pressure reading consists of two numbers, systolic and diastolic pressure. Systolic pressure is the pressure experienced by arteries while heart is beating, that is during systole. Diastolic blood pressure is the amount of pressure in the arteries while heart is resting, that is during diastole. Hypertension is defined by the American Society of Hypertension and the International Society of Hypertension as a systolic blood pressure of 140 mmHg or higher, or a diastolic blood pressure of 90 mmHg or higher, based on the average of 2 or more accurate blood pressure measurements taken 1 to 4 weeks apart by a healthcare provider. Hypertension can be of different types, like the essential or idiopathic hypertension, in which the cause is unknown. Secondary hypertension, in this the cause is known, like vascular disease, pregnancy, kidney disease, etc. Malignant hypertension occurs when there is a sudden spike or rise in blood pressure that puts patient at risk for organ damage. It often happens in people with a history of high blood pressure, but can also occur in people with normal blood pressure. This is a medical emergency and requires immediate care. Now coming to the classification of hypertension, normal blood pressure consists of systolic blood pressure of less than 120 and diastolic blood pressure of less than 80 mmHg. Systolic blood pressure of 120 to 139 and diastolic blood pressure of 80 to 89 is termed as pre-hypertension. A systolic blood pressure of 140 to 159 and a diastolic blood pressure of 90 to 99 mmHg is called the stage 1 hypertension. Stage 2 hypertension is a systolic blood pressure of more than or equal to 160 mmHg and diastolic blood pressure of more than or equal to 100 mmHg. Blood pressure is the product of cardiac output and systemic peripheral resistance. Cardiac output is the product of heart rate multiplied by the stroke volume. Stroke volume is the volume of blood ejected from each ventricle during each contraction. Hypertension can result from increases in cardiac output, increase in peripheral resistance, or both. Increase in cardiac output is often related to increased vascular volume. Peripheral resistance increases due to vascular constriction. Coming to the risk factors of hypertension, the major risk factors are advancing adult age, African American race, alcohol drinking, family history of hypertension, overweight or being obese, and sedentary lifestyle. Other possible contributing factors include use of tobacco products, stress, and sleep apnea. Let's now discuss the signs and symptoms of hypertension. Most people with hypertension do not experience any symptoms. Very high blood pressure can cause headaches, blurred vision, chest pain, etc. Other symptoms include nausea, vomiting, anxiety, confusion, nosebleeds, dizziness, abnormal heart rhythm. In patients with hypertension, taking health history and conducting a thorough physical examination is necessary. The retinas are examined for any possible damage. Routine laboratory tests include urinalysis, kidney function test, fasting glucose, total and high-density lipoprotein cholesterol levels, and a 12-lead ECG. Now coming to the complications of hypertension. The hypertension can cause certain degree of damage to several organs in the body. Hypertension can damage the arteries by exerting extra pressure on the inner lining of the arteries. This, when continued for prolonged time, leads to small tears in the lining, making it rough and suitable for the deposition of fatty bits called plaque. This makes the arteries clogged and stiff. This damage can make artery walls stretch and bulge out like a balloon, called aneurysm. To push the blood through stiff or clogged arteries, your heart has to work harder. An overworked heart can become larger than normal, called cardiac hypertrophy. Ultimately, the cells of heart muscle lose strength and cannot pump blood well. This could lead to a heart failure. High blood pressure is the leading cause of stroke, leading to high morbidity and mortality. Hypertension is one of the major causes of kidney failure as it damages tiny network of blood vessels supplying blood to the kidneys. Persistent high blood pressure can damage blood vessels in the eyes and optic nerve, leading to blurry vision and even blindness. Here are some ways to manage high blood pressure. Exercising can help lose weight and reduce cholesterol level. This helps in managing high blood pressure. A regular exercise for about 30 minutes daily is recommended. Smoking causes endothelial injury, causing build-up of plaque. When you quit smoking, the risk of plaque formation is significantly reduced, thus helping manage blood pressure. Reducing sodium intake is also linked to reduction in high blood pressure. Drinking alcohol is linked to high blood pressure and other chronic conditions and should therefore be avoided. Stress is a key driver of high blood pressure. Several studies have demonstrated how stress management can help to lower the blood pressure. Coming to the pharmacologic management of hypertension, the first line of treatment includes angiotensin-converting enzyme inhibitors like enalapril, captopril, benazepril, or angiotensin receptor blockers like telmisartan, olmesartan, losartan. Initially, patients are given low doses of medications. If blood pressure does not fall below 140/90 mmHg, the dose is increased gradually and an additional dose of medications are included as necessary to achieve the control. Other antihypertensive medications include calcium channel blockers like amlodipine, diltiazem, diuretics like furosemide, dorsemide, beta blockers like atenolol, carvedilol, and other medications. Now let's talk about the nursing management of hypertension. The first nursing diagnosis is the deficient knowledge regarding a relation between treatment regimen and the control of disease process. The nursing interventions include providing the patient with the knowledge regarding the disease process and how lifestyle change and medications can control the hypertension. Emphasize the concept of controlling hypertension rather than curing it. Encouraging the patient to consult a dietitian to develop a diet plan for improving nutrient intake and for weight loss. The next nursing diagnosis is the non-compliance with the therapeutic regimen related to side effects of prescribed medications. The nursing interventions include educating patients about the importance of following medication regimen and lifestyle modifications to manage blood pressure. Guide the patient about the proper way and timing of taking medications. Inform the patient about possible side effects of prescribed medications and when to report them. Thank you for watching. That was all about the hypertension.